Hey everyone, I'm Dr. Walsh. This is Sanibel Chiropractic. I'm going to be showing you around the office and showing you what we do. This is our waiting area where everybody comes in, and we have a couple of short papers for you to fill out so that we can get you started. But you can come follow me down through here. This is our waiting room in here. So everybody hangs out just to try to get seen in a few minutes. Hopefully we keep the lines pretty short in here. But one of the therapies that we do is a hydromassage therapy. This is a therapy that basically works on your muscular system. It's great for before adjustments, just getting everything nice and relaxed. We have some patients even just come in here to get massage. You can do it independent of the adjustments if you ever wanted to come in here. It's a nice relaxing treatment because you can lie in here all by yourself. You have a monitor on here that you can influence how intense or soft you want the massage to be. But I like people just to come in here, lie down, relax, be by themselves for a few minutes and just get that massage before we do a lot of the work over in here. This is our treatment room in here. Our treatment room has several different tables. We do all of our chiropractic work in here. The different tables allow us to do some different chiropractic adjustments. We have some drop tables over in here where if we're doing a pelvic adjustment where we put a little force down on the pelvic area, the table collapses there. It gives it a little bit of a give to the adjustment to make it a little bit more comfortable for the patient while we're going ahead and trying to fix up whatever's been going on. This is our activator table here. This is a table that moves up and down. You can see here, it'll bring you all the way down to a horizontal level. Sometimes if patients are having a tougher time getting up and down off tables, this is a little bit more useful because it allows the patient just to relax and go down to where they need to be. And we do some of our physical therapies over in here. We're doing some heat or ice or electric stimulation on some of the areas where some of the soft tissue needs to be rehabbed. But mainly what we do in here is we try to check all 24 segments of the spine. We try to make sure that they're all in good alignment. We try to make sure that they're off the nervous system. If they're putting a little pressure down on the nervous system, we want to identify which segment is doing so, and we want to provide a correction in there as well so that we can get that area of the body a little bit healthier, get that nervous system working as best as it can, and if there are any negative symptoms associated with it, hopefully we can try to decrease them as much as we can. But not only do we work with the spinal and the pelvic area here, but we do some work on shoulders, knees, ankles, wrists, anything that basically has a joint that there could be some issues going on, creating some pressure on the nervous system. We try to resolve that as efficiently as we can. One of the things that we do here, outside of just the drop table over there and putting some pressure on the bones through pushing it with our wrist, is we also use some low force instrumentation to make any corrections in the spine. This is one of them here. This is called an arthrostim. What an arthrostim does is it provides a pulse onto the bone. If we're trying to create a correction, this allows us to be very specific. It allows us to be specific not only with the amount of force that we want to put in there, but also with the position of the where the bone is, so we can get very locally right on top of there. But our main goal, like I said, is trying to get as much pressure off of the nervous system as we can. If there's any kind of dysfunction going on in the joint, we want to go ahead and identify it, be very specific with it in the most non-aggressive way possible in terms of making that correction. We find that chiropractic is one of the best solutions to any kind of issues with sciatica, low back discomfort, neck, mid-back discomfort, or even headaches as well. A lot of times that comes from the neck, and that's usually where the issue needs to be remedied in order to get some of those symptoms to die down. But this is my office here. If anybody's interested, you can visit my website, sanibelchiropractic.com, or you can call and we'll be happy to answer any questions. Thank you.